talking on the behalf of foremost organization. Today's topic, let's talk about cost of care. Cost of care. Cost of the care can be lowered with segmentation. With segmentation by health status. As I mentioned to you earlier, there are four categories of segmentation. Generally, the insurance premiums are broadly pooled and they're not segmented. When I say segmentation, based on the categories, either number one is well category, at-risk category, chronic illness category, and catastrophic. There are four categories. So the cost of the care, when you segment the risk, that will lower the cost. You may ask how. There are group impacts. There are group impacts and personal impacts to costs. Group and personal changes in behaviors can lower the use of medical services, lower the cost of care, and reduce the premiums, and offsets out-of-pocket expenses which consumers care about. Yes. Nothing like having a nice coffee in the morning and chatting with you guys. %90 of the doctors and hospitals have no idea what are the costs of their care. They have no idea. Hospitals use charge master as a basis of negotiating prices with private insurance companies. Charge masters. Charge master schedules are not related to any procedural costs. They're not. They are prices, not costs. Essentially, they are made up fees. These charge masters by the hospitals are made up fees. Government insurance programs pay hospitals based on another artificial schedule. They're called DRG, diagnostic related groups. That's how they're being paid to the hospitals. They're made up charges. Whereas doctors classify diseases based on international classification of diseases. They call ICD-10. International classification of disease. The doctors do. Then doctors charge fees based on CPT, current procedural terminology. CPT stands for current procedural terminology. American Medical Association creates this proprietary CPT fee schedule. The public has no input. Public has no input whatsoever. Competition is irrelevant. And free market forces are ignored. Free market forces are ignored. CPT codes form the basis of CPT codes form the basis for Medicare payments to the doctors. That's how it works. The free market forces are ignored, consumers are ignored. So they're all made up charges. And they're also a form of negotiated amounts paid to the doctors for private insurance. Yes, for private insurance. Can you now see the medical charges are rigged with insider terminology and self-dealing amounts they can charge? Yes. Do you know that doctors cannot charge less than Medicare? Any one of you know that? Doctors cannot charge less than Medicare. Because government has contracts that require any doctor accepting Medicare to abide by the clause as most favored nation charges. That is the way the contract, if you want to participate, the doctor has to participate in Medicare, he has to sign that agreement. So under the federal law, doctors cannot accept less than Medicare fees from your private insurance companies. Not only Medicare, even from your private, you cannot charge less than Medicare. That's the agreed upon price. Well, some doctors, they opt out of Medicare because they don't want to be obligated, they don't want to be bound by the Medicare. So there are a few doctors out there, they don't accept Medicare. So they can charge whatever they want. Or they can charge below, they can charge even below the fair price. Yes, they can charge if they don't accept Medicare. But it's illegal to charge below the Medicare. That's very interesting because so consumers are basically ignored in this whole gamut. That's the beauty. It's an insider's games, folks. It's an insider games. Using fancy formulas, mathematics to price fix and rip off American consumers. That's the way it is. In most cases, third-party payments like insurers, government, and employers distort normal consumer pricing influences, minimize pricing competition. They minimize the pricing competition and eliminate normal market pressures for transparency. That's what is happening. That's one of the reasons why there is no transparency in healthcare. Because these rules set up by the insider, so-called, you're bound by the Medicare and you cannot charge anything less than what the Medicare, even for private insurance companies. So once you sign that Medicare, most of the doctors do. Most of the doctors do sign the Medicare. So what is the solution? What is the solution? Despite the forces of working against you, you need lower insurance premiums, folks. You need lower insurance premiums. This can't be done in the present structure because you're bound by your contract with Medicare. How can you influence insurance premiums? How can, as a person, influence it? I'm talking about you, consumers. How can you, consumers, can influence the insurance premiums? The solution is, despite these forces working against you, You need to lower your insurance premiums. How can you influence the lower premiums, you may ask? Well, insurance premiums are made up of medical procedure cost versus utilization. Cost versus utilization. Utilization is the number of times a medical procedure is used. That's the utilization. Consumers may not be able to directly set or competitively influence the cost of the medical services. They cannot. But consumers can affect the number of times a service is used. Consumers can do that. Consumers can affect the number of times the procedure is being used. There are group impacts for folks. There are group impacts, personal impacts on premiums through limited patient utilization of services. This is where the consumer comes in. This is where the consumer gets influenced the premiums. By segmenting the insured lives into different categories, like-minded risk classifications, the lower utilization groups will benefit with the lower premiums. This is where the consumer has to get involved. Keep in mind, lower medical costs through lower utilization means lower insurance premiums. This is, of course, a result of segmenting similar health risks and compatible levels of personal responsibility. Yes, compatible levels of personal responsibility. Remember, high-risk groups get government subsidies that lowers their premiums. High-risk groups, they get the subsidy. Lowering personal utilization can lower the premiums or out-of-pocket expenses cost to you, what you pay. For example, if you have a health savings account, you can reward for personal actions added to your HSA account. Those dollars in the HSA accounts based on personal actions and compliance can lower your premiums and offset plan cost sharing like deductibles, co-pays, co-insurance. That is what it offsets the out-of-pocket expenses by a consumer who wants to be responsible. He wants to spend less from the health savings account, so he wants to save more on the health savings. So this is where the consumers pick and choose. They want to save money. They don't want to spend their money. They want to lower the cost. Ultimately, consumers' action will lower the cost. Lower insurance premiums are the real reason personalized health insurance uses risk segmentation. That is the real reason, folks, as the basis of insurance. So consumers can influence in lowering the premiums. You have a right to purchase insurance associated with similar good or bad risks. Why? Because you should be able to share in savings created by the pools, like a pools lower utilization of services. You're involved with, that's why you should have a smaller groups should be able to participate in a larger groups that can influence lowering premiums for a consumer. Smaller groups like self-employed, less than 50 employees, should be able to participate in the larger groups. And by segmenting in a larger group, you should be able to get a lower premium from a larger group. Even one person in the family is impaired, you can isolate him as an impaired group and get a certificate of guaranteed coverage that's government subsidized. But your focus is people who are impaired, and those are the people we need to focus on. By segmenting is you're not exposing that risk to the entire group, because you're segmenting one person who really needs the most attention. So you're lowering the premiums for the rest of them by taking out one individual who's sick. Here is how pooling poor risk in the impaired support plans will lower insurance costs for everyone. Yes, everyone. As I explained to you earlier, personalized health insurance places the individual and small group uninsurables into the impaired health support plans. That means remaining insured are a pool of better risks with a lower expected costs. Lower expected costs. Let's say the cost distribution wise. Let's say the cost of it. 1% of the members, 1% of the members, it costs 20% of the costs. Whereas 15%, this is 1% are catastrophic group and 15% by the chronic illnesses. They consume 68% of the costs. 68%, folks. So you're segmenting those people with chronic illnesses and you're focusing, paying attention, getting a better care, quality care for those people. Whereas 50% of them, which comes in the 95% of the bracket, they hardly see a doctor. They hardly have any exposure. Their premiums should be a lot lower. Lot lower. That's how segmentation works, folks. People in a better health, their premiums are lower. People who are impaired in the group, they need a better care, better quality care by focusing on them, and they consume 68%. That even that group, you can bring down the premium by being proactive, by giving them free lessons, free this, and education, monitoring, telemedicine. Those are the things they need to be monitored by the nurses, by the nurse practitioners. Those are the people we need to focus on. By doing that, you're lowering the cost to the rest of the 95% of the population. This is how the risk segmentation. Right now, the risks are not being segmented in the insurance industry. But the consumers, once they have these HSA accounts, they can do it. They can demand for it. Based on the research at the Employee Benefit Research Institute, it's called EBRI, 1% of the group members generate 20% of the total healthcare cost, folks. 1%, just 1%. It is this population that would medically benefit most from the impaired health support plans. This is this segment. will benefit the most, the 1%. Moving this population into impaired health support coverages will lower individual policy and small group contract costs by similar amounts. Those wanting lower premiums on plans with higher deductible plans should have this option. The catastrophic coverage, some folks want to have a short-term catastrophic coverage. That should also lower the cost. Some people doesn't want catastrophic coverage for all their lifetime, only temporarily, so they can get a catastrophic coverage. That should lower the cost and the rest of the premiums. Everyone should be able to choose any lower premium plan they want. This is what the personalized healthcare accounts work. Consumers have to be given personal responsibility. As an individual, as an average American, I see most of these Americans are hardworking. You're punishing the hardworking Americans, majority of them, for instead of focusing on the smaller group which we need the most attention. So this is how the personal health insurance works, folks. To get personalized health insurance, as I mentioned to you, you need a HDHP HSA. Do go to HDHP HSA. What it is, HDHP stands for High Deductible Health Plan. I renamed it as Health Disclosure Healthy Premium, so you can lower the premium. And HSA is known as Health Salvation Advantage. Folks, thank you for joining. I need your comments. This is how the consumers benefit from personalized health insurance, folks. This is what my attention is. Thanks again. And we'll love to hear your comments. Hit that subscription button, and also try to see if you can share